Little Steps Live. We are here in Singapore this week, which is super exciting. Can't wait to tell you about this topic that we've got going on today, but a couple of reminders before we get started. So Little Steps, as you know, we go live, or we strive to go live every week. Sometimes we do go live twice a week. It is every Monday, typically around the 2:30 mark. And so make sure that you tune in. The easiest way to make sure that you know which topics are coming up, because we do now have all of our June events all slated, is to log on to our Facebook page. You can just click on the events side and you'll see the upcoming Facebook Live sessions that are coming on at Little Steps Live. Click that you're interested, and then you'll get automatic reminders straight to your phone. That's the easiest way to stay in touch. We'd also like to hear from you. So if you've got some topics that you want us to cover on Little Steps Live, just email us, leave us a comment, and we'll be sure to make sure and put them into the scheduling. So yeah, without further ado, I want to go ahead and introduce our guest today. So as you know, Little Steps, we do put a very solid focus on education, after school activities, and special needs. And special needs is an area that we have been very dedicated to for years at Little Steps, but with the thing with everything around education, but especially with special needs, is that you can never do enough. There's so many resources out there, and so many fantastic experts and family members that have insight and resources that are for families that need it, and we want to do more. So this is a very exciting topic for us today, which we're going to be chatting with Pippa, who, Pippa, I'm going to give you her introduction because she does have a couple of roles, as you do in Asia. She is a school counselor at Tangle and Trust School. A client of Ames Global, which you'll have to tell us a little bit more about, but they do provide full-time therapists to families with autistic children. So that's actually how we met you as well. So yeah. Thank you, Ames, for that introduction. But the most important thing, she's a mom to Hetty, who I just met. Fantastic little girl who is ASD. So she is on the Autism Spectrum Disorder, and that's what we want to talk about today. So the way we're going to take you through this is, first we want to introduce Pippa and get a little bit more background, both personally, but also to chat a little bit more about your journey, both as a parent, but also as a counselor. You've got an interesting background there. And then we're going to go into 3 different areas just to kind of slice it up. So we're going to be talking about ASD, understanding a little bit more about it, what it is, and kind of uncovering some of the myths. Then we're going to get more insight from a parent perspective, which will be fantastic, very personal, and your journey again. And then we'll round that up with some key resources and some support that for families looking for that you can go ahead and tap in. And that's what we like to do at Little Steps, as well as take you straight into some of the support networks as well. So without further ado, welcome to Little Steps Live.
Thank you.
So so Pippa, tell us a little bit about yourself and of course your family. By the way, we are at Pippa's home right now. It's beautiful.
Thank you. Yep, so we've been in Singapore 11 years. We lived the high life for the first 5, and then we had kids when Hetty was born, sort of 5.5 years ago.
Okay.
And we've got 2 more kids, Riley, who's 3.5, and Bruno, who's 2. As you said, I work at Tanglin. I've worked there the full time, moved out here for the job.
Okay.
As a teacher first, and then I moved into school counselling about 5 years ago. And that's what I'm doing right now. Toby, my husband, he works for JP Morgan, and he's worked there the whole time as a banker.
And always in Singapore?
Always in Singapore. It's always been that classic. Every 2 years we say, right, what are we going to do next? And we just haven't moved, and we still love it. So it's still a good place for us.
Excellent. Okay, so you've got three kids. So Hetty is your oldest.
Yeah.
And it sounds like that's also when you made your transition into the counseling side as well.
Yeah, bizarrely, that was a massive coincidence, because actually I moved into counselling when I was on maternity leave with Hetty.
Okay.
So yeah, so that was an interesting kind of I don't know, some sort of fate stepped in there, because I really feel that some of the challenges that I've had faced with Hetty have been mitigated a lot by my training,
right?
And also just my want to sort of help sort of new families with this challenge with autism,
right?
With kids with autism. I kind of think I've just got a bit more handle on the right language now to use with them, and sort of a bit more kind of opportunities to help families who are in that predicament, because it is quite a lonely place in the beginning.
Right. And it sounds like since you were already connected into a school, Tangle and Trust, that too is a big challenge for families, whether they're moving here or they live here and now they're trying to navigate the school scene. So we'll get into that a little bit as well, because that's certainly always a big question for families as well.
Yeah.
So let's go ahead and get started. So as I mentioned earlier, we are here with Pippa. We are going to be talking all about autism, the Autism Spectrum Disorder today. We have basically sliced it up into 3 areas so that it's easy for everyone to follow. And please feel free. We are live, so please feel free to ask questions. We've got a mom here that can really share a lot of great insight, a lot of support, and so please feel free. Just leave it in the comment section and we can answer your questions live. So the first area that we want to talk about is about autism spectrum disorder, also known as ASD. So firstly, there is a lot of confusion on what exactly is ASD. So maybe you could explain to our readers in simple terms what it is.
Sure. So I suppose I've got a caveat by the fact that Hetty is autistic and I'm an expert in Hetty, but I mean,
it is very individualistic.
It is a very individualistic thing, and I will explain a bit more what I mean by that. But ultimately, it stands for Autism Spectrum Disorder, and it's the spectrum bit that is the key to understanding it, because you can have one kid who's on sort of the far left of the spectrum and quite low functioning, and then you can have a kid on the far right of the spectrum who's very high functioning and almost sort of that typical kind of like Curious Incident, or Rain Man scenario where you get very high functioning.
When you say high functioning, that's what does that mean by functioning?
High functioning means basically that they are able to interact and adapt to society and get a job and are independent, but they might even take that even to a point where they actually have a special skill, but that's quite unusual.
It is. Okay, so it's more rare.
It is more rare. And I think that's one of the kind of the myths about autism, is that you do get kind of a slightly skewed perspective when you do see things like the kind of those kind of
the movies,
the
right?
movies, because there are only a very small minority of people who are so of that genius capacity. But I mean, there are very high functioning kids, and it's often their speech and their communication that sets them apart from, say, a lower functioning kid, who may have those challenges and social inhibitions. But I'll talk about that a little bit later too. But ultimately, as I said, there's a huge arc of behaviours, and they say for every 100 autistic kids, you get 100 different types of autism. So it's really difficult in the beginning to navigate what is kind of just a behaviour, isolated behaviour that might just be sort of a slight sort of quirk in a kid's character, and what is actually autism. And I think that the best way to describe it is whether there is a frequency of those behaviours and a situational element to that. So how often do they happen, and when do they happen, and is there a consistency to that? And I think that best describes sort of what the spectrum is all about.
So what would you say are some of the key characteristics that a child with ASD stands out?
So again, it's very kind of personal to the kid, but ultimately it tends to be centered around either a sort of a sensory nature or ritualistic behaviors, social inhibitions, or incapabilities to sort of read social cues, body language, facial expressions. They can be quite isolating. Maybe they have sort of certain interests that don't necessarily they share to the same kind of capacity that you would normally. But in, if we were to sort of talk about sort of some of the kind of the markers that a lot of people say, it's sort of that avoidance of eye contact, when they're little, the lack of pointing.
And when you say little, is that how little?
So right from, I mean, it can happen as early as as soon as they're not hitting developmental milestones, really. I mean, it kind of kicks in, even in those sort of first early months, it can be that lack of interaction, the first smile might not happen at the right time, the rolling, might not happen at the right time. Later on, the lack of pointing is another thing that they don't sort of. A lot of kids who are autistic don't point things out.
So if you were to say,
if they were like a bus or whatever, then they wouldn't say "mummy bus." They would just either stare at it or not reference to it at all. It would just not be even in their world. repetitious behaviours, as I said, sort of laughing or crying quite sort of erratically.
Right.
And speech is a big thing. So
Okay.
often autistic children can be delayed in their speech.
Okay. Speech delays. Okay.
Yeah.
And then what about interests? Are there certain interests that are typical for
I
autism?
mean, some kids again will be very interested in one particular topic or a movement. So, for instance, wheel spinning, fans. Some have lifts or elevator fascinations, but others don't have any interest at all. And in fact, that can be part of the problem as well, that actually they have to be taught how to play. They have to be taught how to
Socially
initiate their imagination.
Okay.
So it can again be a bit of a spectrum of those kind of idiosyncrasies as well.
Okay. Now I know there's a lot of confusion between ASD and Asperger's.
Yeah.
Why is there a lot of confusion, first of all? And what would you say are the typical?
Yeah, the reason for that is because Asperger's is basically just part of ASD.
Okay, so it's on the part
spectrum.
of it. Okay.
So that arc that I was talking about before, it's basically on the higher functioning side.
Okay.
So those examples I gave of the sort of the curious incident in the dog in the nighttime, he's probably more likely to be Asperger's because he has very adept speech, very strong communication, but his sensory markers are very, he's very inhibited by sensory stimulus. Very focused on particular subjects. So I'd say that it's the best way to describe Asperger's is just a higher functioning side of autism.
Okay, that's all right. A diagnosis. I know obviously when you've got a little baby and you're worrying about, it typically starts then, right?
Yeah.
You've probably read quite a bit, and you're wondering, oh wait, is my child needing to go through some sort of assessment? Can you take us through maybe, when that diagnosis should occur or the assessment?
Yeah, and that's really tricky to answer because it's really when those needs are initiated in the first place. So for instance, for some parents it's really clear from birth, as I was saying, that perhaps those milestones are just not being met. A paediatrician might point them out, but most likely it's the mum who's going to notice, because if they're with other babies, they're going to obviously comparing. Some may also be in denial about it, so they may not do anything about it for a good while. And particularly, I suppose, in some Asian communities as well, there is a cultural shame about it.
Yes.
So they would rather, keep it behind closed doors and not deal with it. So I'd suppose the answer to it is that an early diagnosis is best, but it doesn't always happen.
Right.
The experts say that, it's better to get the kid diagnosed before 2, but it's really hard to get a diagnosis before 2 in some places.
What is the assessment like? Is it...
So for Hetty, they went into her play school, and then they did a specialised testing within the office. So they tracked her within school and saw her interactions with other kids, and I suppose her ability to sort of interact with the general lessons and activities that they were doing, and then they did a full assessment. But actually, if parents were kind of worried about it and just wanted to do a home test, then there's something called the ATEC, ATEC, which is almost like an online marker testing, and although it's not fail-safe, it gives some indication of where they are on those markers and what kind of things that they can and can't do. So that's sometimes a good starting point. But usually it will be through a paediatrician. And they will refer
so that would be the starting point.
And they will refer you to a behavioural psychologist who will go through those testing procedures. But then the problem with that and the good and the bad thing about it is that they can't offer you some magic cure.
Right.
So that's when the hard work starts. That's when the interventions have to kick in based on what your child is presenting. So you have to start with the occupational therapy. You have to start with the speech therapy. You might go into behavioural therapy. Or ABA, or you might decide to go on a play therapy route. There are so many different ways of kind of tackling autism,
and it's just dependent on
dependent on the child, and also the parental resources, because it's very costly too.
Yes. That is one challenge I think in Asia in general, is the cost associated with special needs.
Absolutely.
I mean, there are some options, which is great. I feel like in Singapore there's some nice options. But yeah. So before we move in, we wanted to talk a little bit about what is autism, some of the, the general questions that we see But before we move on, we do want to, first of all, is there anything else around the main topic that you see as confusing at all? And I want to open it up to our readers as well, if there's any questions about autism and any of the myths that you've seen that you want to ask before we move on. All right, so we'll move on to, I think, the most exciting part, which is the parent's perspective. So we are going to now chat with Pippa about being a parent and to talk about the journey of having Hetty and the whole round. So thank you so much for sharing this, because it is very personal.
Yeah.
And so let's go ahead and get started. First of all, a couple of questions. I did just meet her. How old is she?
So she's 5.5.
She's 5.5.
Yep, she's a happy little girl who loves My Little Ponies and animals, and that's her kind of thing. She only really started talking about a year ago, so her communication is still very much
around
developing.
4.5, would you say?
Yeah, around 4.5. It was really low and slow, but we're really hopeful now that communication will open a lot of doors for her, both sort of socially, but also in her ability to be much more confident in herself and
express
independent.
herself, right?
Yeah. She works hard on the kind of the social side. She is that anomaly within the autism spectrum where she is sociable, but she doesn't have that social awareness to be able to read social situations, and she can't necessarily keep up as well. So we do get cases of her sort of over hugging people and getting a little bit too close.
You know what? The world needs a little more of that, right?
So that we have
to Space Invader.
Space Invader. Space Invader. Don't be a Space Invader.
Yes.
Yeah. So she's progressing really. She's a steady Eddie. She's not a kid who kind of like sort of has spurts, you know, of sort of in her developmental profile, but she does keep on developing, and every intervention that we are putting in seems to be contributing to that layering of the foundation.
So you're seeing the progress, and that's obviously very motivating as well.
It is, and it's really hard not to get very, very excited when you see a real developmental leap and then go, right, she can do X, Y, Z, and then bombard her with too much. Right. And so I think one of the things that we've learned is that low and slow, and sort of I know that, you know, it's really natural to compare with other 5.5-year-olds. Right. And, you know, you will always constantly have that at the back of your mind, that you can see them sort of whizzing alongside, and her not being able to keep up. Right. But at the same point, you know, she's dancing to her own tune, so you know, you've just got to dance with her, really.
Yes, yes, I like that. So what? Obviously, there's some characteristics that you noticed at a young age. Yeah. What brought you into saying, all right, I need to get this checked out?
Yeah, well, it was really, I mean, Hetty was our first baby, obviously, and looking back, to be honest, she didn't really display any behaviours until she was about 18 months old. Okay. So, you know, I rack my brains a lot of times to think, you know, was the things that I missed, were the, should I be more on it, basically? But actually, the paediatrician didn't notice anything. I honestly, you know, yes, there were certain things that perhaps she couldn't do, but there were other kids who couldn't do them either. Right. Do you know what I mean? It wasn't a huge thing. But then at 18 months, it was almost like a switch, where the light just went out in her eyes. The world was a really scary place for her. She just became more and more aggressive. The words that she did have suddenly plateaued and then fell off completely. And she was very isolated. She found in new environments very, very sensorily stimulating. Okay. And she couldn't block out whatever it was that was triggering her. Okay. And therefore she would scream and cry a lot. She would also have that slight scary sort of running off without any sort of sense that we weren't there. So you had to have eyes like a hawk on her. And so it was those kind of markers that really alerted us. Yeah.
And then you went in, We
went in, so I had a summer with her where basically I was on Dr. Google a lot, and then I just went into the pediatrician and they referred me to a behavioral psychologist. And
did you have an idea at that time, like where this might be going, or could it have been so many different things at that stage?
It was... Yeah, I mean, pretty much I kind of had a clear idea that I was heading... there was a lot of denial going on, and a lot of kind of talking yourself out of it that was going on, but at the same point, when they did give me the diagnosis that she was autistic, that wasn't a huge surprise, but as I said before, that's just the beginning of the story,
Right.
and it's the overwhelming and daunting nature of kind of what you do next. You walk out of that office, you know, basically what you thought you knew has just been totally,
Right.
or all your expectations had been completely ripped out, and
Yes.
and it was almost like there was a blank slate, and you were the one who had to sort of make the decisions
Right.
about what
Right.
that was going to look like. So I went into a bit of a shock. I isolated myself. I tried to fake it for a while because it was easy in the beginning to fake it because she just looked like a badly behaved child.
Yeah.
So you just could just take her into scenarios, but that wasn't helpful. That wasn't
And was
helpful.
that, would you say that's part of the denial side?
Yeah,
Okay.
totally. But in the background, I was doing hours of research.
Right.
I was up to all hours, just researching,
Gotcha.
trying to navigate what we were going to do and how we were going to do it. And that wasn't just the kind of the educational side. It was also, I was looking a lot into the biomedical and the nutritional side of it, because that often goes in hand with autistic children as well. So I looked a lot at her, you know, health plan, and we did do a lot of diet intervention as well in the beginning.
And did you feel like you were putting this into play more so than the doctor? Or
I mean, in fact, the behavioural psychologist, there's a lot of I suppose a reluctance for the biomedical side, because it is basically unproven, you know, in their world, and so they don't feel as though necessarily it is worthwhile. But for us, we had to try, and so we decided to take that path alongside the kind of the behavioural interventions as well.
Okay.
So we started off basically with quite a structured ABA therapy.
Okay.
Yeah.
Okay. And ABA therapy, so that's
applied behavioural analysis.
Okay.
So that's what it stands for, and it's some criticise it for its quite formulaic and rigid structure, because it is basically a kid cannot move to the next level until they have actually achieved a certain skill set. But for us, it was great in the beginning because it just gave Hetty that independence and skill set that I didn't have the patience and time to teach her. So for instance, things that kids would get automatically, like being able to put on a shirt, you know, she had to really, you know, break it down, and it took ages, you know, even toilet training took ages, you know. So those kind of things were really helpful from the behavioural analysis point of view, but then we came off it quite well. Basically, Hetty told us when we should come away from it, because it just wasn't, it's not natural, in, you know, you're not able to function like that all of the time, otherwise it's quite robotic, and you need the kind of the other sort of slightly more, you know, sensual sides of life to be able to interact as a sort of fully functional human being. So that was only one side of the story, but it was useful at the time.
And then so she's now five and a half. Is she still doing the ABA?
No, so she came off that.
Is that more of an early intervention?
Well, we did it as an early intervention, but we actually did it in parallel with what's called a floor time intervention, which is a play therapy. So she was actually doing both. I don't know whether that was confusing, but at the same point, we thought that was the right.
I guess you're trying things
We're trying
out too,
things
right?
out, and there is a lot of trial and error in this game. And so we did it in parallel, which is not necessarily a conventional route, but that was our way of giving her the social sort of emotional side, as well as the sort of the more structured, rigid behavioural
and play
side.
Therapy, what is that exactly?
So the floor time therapy follows sort of it's a very child-led, play-centered philosophy,
which is more fun, I'm sure, for that age as well.
And it really focuses on sort of the grounding of the emotional side and matching the kid. So for instance, particularly if they're non-verbal, it will really match. They will play at the kid's level. They will mimic exactly all the noises and the things and the behaviours that they show. So for instance, if there is, you know, one of the sides of autism that is flapping, you know, they will actually join them with the flapping and make it a game to show them that actually the kid, whereas in applied behavioural analysis that would perhaps be mooted, that would be that would be something that they would try and eliminate. So it's, although it must have been very confusing for Hetty, but at the same point, for us, we just needed that sort of softer side, and also the skills, the fundamental skills.
I guess again, you're trying different things out to see. Out of curiosity, did you have a good support structure at that time?
Do you know, that's an interesting question.
Sorry, I didn't put that in the questions.
The people that you rely on are obviously your friends.
Yes.
And you work out pretty quickly those that actually do have the time to listen to you in the right way, because and people are busy, you know, and it's not their life, and you know, so you have to be careful not to be you know, that mum, you know, who talks about autism the whole time. But at the same point, Toby and I have had to really dig deep, find you know, different parameters to our relationship that you know, we didn't think we would have to go near. So we obviously that for us is important, that we're a strong team at the helm, so that she feels safe with that too. And there is a huge support network in Singapore of parents, you know, because unfortunately autism was on the up for whatever reason. It's on the up, and there are so many parents out there who are willing to help and to share resources. And in fact, I mean, I can give you a couple of names either now or later.
Well, we're going to get into all the resources, because I do think that'll be a whole nother section of things that I think parents will certainly appreciate from. So in terms of, I guess the challenging, there's a lot of challenges around raising kids. You obviously had 2 additional children after. Can you take us through some of kind of the big challenging points?
So I mean, the challenges really are yourself. So it's finding you find patients that you never knew that you had. Your perspective on tolerance, both positively and negatively, can shift. Your attitude to success changes. So what does that mean? What does that standard? You know, that benchmark has to shift. You have to say no to a lot more things. So
it's like overall priorities change.
Priorities change, because, you know, you can't put her in situations where, you know, you think that she's going to fail, but at the same point we've also want to challenge her as well in her own way as well. So we don't totally isolate her from things, but we don't also set her up to fail.
What do you find the most rewarding?
The rewarding things are obviously, like any kid, you just get moments of celebration where they achieve things that you never thought that they could do, and obviously that's really cool. I mean, ultimately they are actually quite easy in a lot of ways, because they don't really manipulate you. They don't really answer back in the same way as say my 3.5-year-old will. She never really lies. So
it's kind of straightforward in some ways.
It's very straightforward. So I mean, it's very So in some ways, as long as you're
she's straightforward and she overhugs. She's fantastic.
Pretty much. So so there are a lot of rewarding things. But it's, again, as I was saying before, it's those standards of success that just shifts, and so you just mediate those. Okay. Before we move into those resources for parents, is there anything else that you want to share, perhaps to the families that are out there that are going through it, starting their journey, perhaps in the denial phase? Anything that you want to kind of share in terms of the challenges and kind of where you settle? I mean, ultimately, I really think that it sounds a really weird thing to say, but if you put yourself first, if you're not in a positive or a stable mental state of mind, nothing works. Because particularly for Hetty, she is so on point about people's vibes, and you know, the kind of the mood changes in people, and she responds so sensitively to that. It's almost like a weather gauge. So ultimately, if I'm in a bad spot and I'm not dealing with her in the right way, she will respond to that, and then we're in a whole heap of trouble, because ultimately both of us are not behaving very well. So my best advice to people is that get the help that you need in terms of support networks. Even if that means counselling and going off and even it means going off and getting your hair highlighted or massages, you know, because you do need space and time away from your kids. And I mean, I will talk a lot about AIMS later, but ultimately that sort of home-based therapy gives you that opportunity to have the best of both worlds, where you can actually see your child in the home, but you're not necessarily having to be on all the time.
Right. Ah, okay, cool. We're going to have to definitely hear a bit more about that. I'm curious as well. So thank you. That's I'm sure we could go on and on about the parents' perspective, because there's a lot of questions out there. We do want to move into the key resources for parents. Are there any questions before we move into this section?
Yeah, actually one parent just asked, what's the best advice for parents that have a child that has just been recently diagnosed?
Okay, recently diagnosed child with autism. What's your best advice?
Don't jump into anything too quickly. Because every expert will think that their modality is the best, and it has to be done right now. Otherwise, you might miss some developmental goal.
Okay.
I would say that you just have to, again, work out how you feel about it first, to take care of yourself. I mean, ultimately, yes, there is a certain amount of time game, the fact that you have to sort of do things when, you're told that you have to do everything when they're little.
Right.
But ultimately, that's not necessarily true. I've seen kids whose intervention started when they were 13 or 14.
Right.
They have progressed so beautifully, with the interventions that their parents chose for them. And they probably didn't know that necessarily it was a challenge for them up until that time. So I would say go low and slow, read. Yeah, find your support network, look after number one, all those things really.
Excellent. All right. So we're going to move into more resources from Pippa. So this is a parent of Hiti who is ASD, and we want to talk about the resources that you found useful. So without further ado, let's start with some basic advice for kids that are raising a child with ASD. I think we've covered some of this.
Yeah.
But are there some other pieces of advice that we want to dig into, or we want to move straight into the key resources that you've found helpful along the way?
The only other thing I would say is just, again, read your child's filter as well for their capacity for certain therapies, because we went hard and fast in the beginning and made a mistake. So Hetty was actually doing about 25-30 hours of therapy a week, so that was schooling, and that meant that I was buzzing about like doing 12 journeys a day, and that's not sustainable. And she had such limited vocabulary, and turned around to me at the age of about 4 and literally said the words "no more."
Oh wow.
And I knew that I had to dial it all back. And funnily enough, that was around the time that we were kind of thinking about AIMS as well. So it kind of worked perfectly. But you have to watch your child, because only then did suddenly she become happy, and then she started learning. And it seems a very simple kind of concept, but ultimately, if your child is happy, they have the capacity and the openness to learn. So she was tired. And so you've just got, I know it's really tempting to kind of throw everything you have at the child, but you have to remember that, and ask yourself, could I actually go with that?
Yes.
And I mean, I was looking at her schedule and it was longer than mine. So,
but it is hard, because I think as a mom and a dad of a newly diagnosis, you want to do it all, right?
Yeah,
You're just like, sign it all up. So that is a very good tip, I think, just dial it back. And can we talk a little bit about AIMS, because you've mentioned it a few times, so maybe we chat about that, because that's a fantastic resource.
Yes, so AIMS is sort of this unique model that is tailor-made service that's home-based. Okay. So ultimately,
and is it in Singapore? Where's the HQ?
It's global.
It's global.
Yeah. So they have therapists all over the world. Some in Asia. It's around. They have Jakarta, the Philippines, Singapore.
Okay, everywhere.
It's very progressive now. And the AIMS therapists are trained under the AIMS model. And AIMS stands for Awareness, Interests, Movement, and Sensory. Okay. And so rather than it being concept-based, it's interest-based. Okay. So they will only go as fast as the kid and for the interest of the kid. So for instance, Hetty became really interested in volcanoes after we went to Bali and there was the threat of the volcano going off. And so our therapist created this whole project-based learning around volcanoes, but the phonics came into that.
Okay. Online. This was online.
No, she's
here
in-house,
in Singapore.
in-house.
Okay.
So So she lived with us.
Okay.
Yeah, at the time. Yeah. So that AIMS can be a live-in service, or it can be a live-out service, or it can be a shared service. So we actually share with another family.
Okay.
So she's with us half the time, and she's with another little boy for the other half.
Got it. Okay.
So it's we're as I said before, we're told that the greatest therapy for our kids is starts in the home,
right.
And from whatever reason, I mean, my capacity as a working mum, or my emotional capacity to be with Hetty the whole time is just not. And obviously, I've got 2 boys, so I mean, I really see why they say that, because ultimately, the comfort of home, it's familiar territory, and for a lot of kids, that's the problem. Is the fact that they're very, very scared of the world. And the therapist within AIMS can act as that chaperone through life being. And I mean, Hetty's therapist is like her best friend. I mean, she spends a lot of time with her, and they do everything from, scooting, swimming, going off on excursions, going to the dentist and getting her teeth checked, which, is a big thing.
Yeah.
She will do all of that with Hetty, but at the same point, they do go through the sort of the basics and the fundamentals as fast as the child can do it. So I mean, Hetty is learning her phonics. Yeah. Hetty is learning sequencing, and all the things that you perhaps would be getting in school, but at the same point, it's very home based and very natural.
Yeah, it sounds like a great resource. Also, I think
it's
just
amazing.
being in Asia sometimes can be. You don't know where to start, and the fact that they can come to your home and that they're global.
Yeah, and it's taken the pressure off us, because we can spend more time with the boys, we can spend more time as a family, and when I'm here, I'm more present, because I'm not worried that I haven't done a jigsaw puzzle with her, or I haven't
the things on the list,
the things. Yeah, exactly. So, I can relax within that too, and she gets the best out of me because of that.
Yeah. Oh, that sounds great. So other key resources that you find helpful in Singapore or in Asia?
So, I mean, I'll just tell you the ones that we used, and then people can sort of...
And maybe what we'll do is we'll get these and we'll put them in the comments so that you can easily access these, after we chat.
Yeah, sure. So we used the ABC Centre for ABA Therapy in the beginning, and they were a very, very interactive, and although I did say that ABA is a very rigid structure, this one was very sort of naturalistic. It wasn't like the clicker dog training that you can associate with ABA therapy. It was a lovely nurturing environment, and very communicative with parents, and they train parents actually. They do a parent training, which was really useful for us in the beginning. Mighty Oaks, we did a lot of floor time play therapy, and she was there for about 2 years, and that again was a great resource for her sort of her play and imagination and her sensory defensiveness.
That was preschool?
Preschool, So that it markets itself as getting the kids ready for school. Right. So it's a like that halfway house, the readiness program. We did oral motor speech therapy with Kamathi at Kids Talk. She was great. Sort of just a lot of, it's quite arduous, but at the same time necessary sort of muscle memory exercises for Hetty's mouth, because she didn't talk, and so she was so late, the muscle wasn't developed enough, and she needed to do that almost like a full exercise, like an exercise program.
And is that a standard thing along the spectrum, or is that specific?
Only if your kid is speech delayed, and it just depends on the kid, what their intonation is like. Whereas Hetty's was very sort of puppy mouth, it was very soft. So she struggled with that, and so she got a lot of intervention with that. But we also do a floor time speech therapy, which we're still doing with Agnes at Bubblebee, and that's a very play based, and it's forcing. That's not the right word, because that's totally against floor time. Right. It's prompting sort of that play vocabulary, so prompting the imagination and all the words that come out for that, and then joining them with that and seeing if you can kind of build that vocab with that. So it's a real vocab stimulator, but at the same point it's all done through play, so she doesn't even know it's speech therapy.
So it's playtime learning.
Very playtime. And then she's doing AIMS in the morning, and a combination of assisted schooling at We Care, which is a great little school.
We Care.
It's a very funny name. WEE Care. And it's a mainstream class, but she's got an assisted she's assisted in the class.
Okay.
So she's and her interactions are with totally normally functioning kids.
And how did you find WeCare?
So it's on the list. It's
one
quite
of the things? Okay.
It's one of those schools that is actually quite popular, and it's a unique program because it does actually allow that sort of natural integration, and they
Right.
try and integrate the child into mainstream as fast as the child is able, obviously.
Okay.
And Hetty does do a lot of time outside of the classroom, but she also does for the appropriate lessons.
Right.
She goes in and joins them.
Got
and,
it. Okay.
And it's
So it's
just classroom
fully-
readiness, really.
Yep.
Yeah.
Yep.
And then she also goes to, so she does WeCare for 3 days, and then for the rest, for the 2 days, she goes to Little Hands on Balmoral Road, which
Okay,
again
yes.
is another sensory program where they've got sort of normally functioning kids, but then they do really welcome challenged kids as well. Yeah.
Oh, great. And then kind of looking forward, do you have like specific plan for
Yes, we
moving into
do.
primary? And
yeah, we do. We hope eventually. We've had a couple of rejections along the way, but you pick yourself up
Yes,
and move
that's
on.
right. Yep.
From international schools that we're thinking.
Is it hard, like to?
It is hard to find the right program, but not impossible. There are
Okay.
options. Again, as I said, it's a cost issue as well, because special needs
Learner
always
support
comes
is-
as a percentage more than you would pay for normal schooling, because of the interventions and the resources that they have
That's
to put
right.
in place. But we're not kind of feeling that we've reached the end of the road.
Right.
We definitely have options, and in fact, WeCare goes on until she's 7. So I mean, she has got a little bit of time before we actually have to worry about that. And I must admit, I was thinking about that kind of question earlier, and the best thing, and I suppose the frustrating thing about autistic children is that the fact is that you never really know what they're going to achieve within that year. So
Right,
your benchmarks may shift. So you might have an idea with a normal kid, you know, what they're kind of able to achieve,
Right.
and what kind of school might be good for them for 5 or 6 years.
Right.
But with an ASD kid, it's really hard to sort of put that parameter on them, because they can really switch and change with the tide, and their abilities just can plateau, or they can zoom off into the distance. So
Right.
I mean, you just have to be really flexible with your plans, really.
Right. Well,
Yeah, but Singapore does have a lot of options.
yeah, it seems
It
that
does
way.
have a lot of options, and we're lucky.
Yeah.
And the benefit of it is that it's fairly contained. You know,
Right.
if I was in the UK, I'd probably have to be doing hour and a half journeys to get to
Right. Yep.
experts.
Yep.
But here, you know, it's 15-20 minutes down the road, and that really is quite achievable.
Good. Well, thank you so much. One more question: are there Facebook groups that you'd recommend, or are there
Yes.
any kind of other parents? And do you recommend that kind of communicating with other parents that are going through this
Yeah,
journey?
absolutely. And there are 2 Facebook groups that I have found particularly useful, and one of them is this one actually has just started up recently, and it's called Hope for Our Little Ones, Puzzling It Out in Singapore.
Hope for Our Little Ones, Puzzling It Out in Singapore.
Yeah.
Now, is that specific to ASD, or is that
Yeah,
special
it is
needs?
actually. It is. It's specific to ASD, and it's mainly for under 5s. And the reason why they set it up is for those parents who, want to ask a question about, say, a worry that they have.
Okay.
And I see it often that parents will post on public forums, and
Yes.
they will get placated to a
Yeah.
certain
Oh, yeah.
extent.
No, they can be quite nasty.
Yeah, and they will almost underplay it and just say, well, you don't need to worry,
Yeah.
you know, it's just, but I mean, that hunch has obviously come
Yeah.
from somewhere.
Yes, that's
so
right.
they need that forum to ask it in a safe
That's
place,
right.
and this is that. And then the other one is Puzzling It Out, and that is it's obviously developed by the same lady, but that's later on when
Okay.
you
Oh,
kind
that's
of
quite
you're
helpful.
established in your autism journey, and you just want to have that kind of interaction with people who are in the know and are
Right.
in the trenches with you. But the one for under 5s is particularly great, because it really helps those parents who
that's
are just
great.
starting out on their autism journey.
Okay, great. We'll make sure to include all those in the comments, because it will be helpful to have it a click away. So thank you, Pippa, so much for sharing this
welcome.
information.
Yeah.
Just want to head it over and see if there's any other questions from our readers. We've covered a lot, but I'm sure there's a lot more questions out there.
So we just want to say a shout out to Emily Wong,
Okay.
Tyler, and Catriona
Okay.
on Facebook.
Okay.
They just left some comments and likes,
Okay, fantastic.
Great.
Fantastic. I guess if we don't have any other questions, then we'll wrap it up. So thank you so much for joining us on Little Steps Live. Again, join us every Monday, 2:30. We'll be live. Next week, I believe we're going to be at the Conrad Fair, if I'm not mistaken. I need to double check myself. But we will be live next week, again in Hong Kong. This one we were lucky enough to do in Singapore with Pippa. Just a reminder that if you are watching it after we are live, please continue to ask questions. So we will tap Pippa for those answers. So ask your questions, and we'll make sure and feed it right back to you. So again, thanks for joining us. Till next time.